Hey there, it's Anthony Silm, and in this video we're going to talk about exactly how does Medicare Part D work. Part D would be for prescription benefits, and with Medicare it's complicated as always, so we're going to break this down so that you can get the most prescription drug coverage for your dollar. Let's take a look. Okay, so whether you've decided to purchase a Medicare supplement plan along with original Medicare, or you're enrolled in a Medicare Advantage plan, it's important to know how Medicare Part D works, because with Medicare, the one part of Medicare that is unique is that your prescription benefits and your medical benefits are paid completely separate from each other. So think of it as two separate ecosystems. It's two different worlds, and you have to understand how Part D works because it can have a big impact on your financial bottom line in retirement. So whether, again, if you have a standalone drug plan, you're going to have a monthly premium. Some of those zero premium Medicare Advantage plans include the Medicare prescription benefits automatically with no cost. So depending on where you're enrolled there, you could have a monthly premium, but you also could have a deductible for your prescription plan. The average monthly premium for a standalone plan is $34. Some of them are as low as $15, some of them are as high as $100. So depending on which plan is best suited for you, that there could be a difference in cost. The prescription benefits, though, all work on a calendar year time clock. So whether you're enrolling in January or November, your benefits are all going to start over every year on January 1st. And each plan uses a drug formulary. So drug formulary is just a fancy term for what insurance companies call a list of medications that they will cover. And each company and each plan has different drug formularies. These plans also break up those drugs into different tiers. So you may be familiar with drugs being on Tier 1 generic, Tier 2 brand name, Tier 3 non-preferred, etc. Some of the plans have 4 tiers, some have 5. It just depends on which medications you're taking and where they fall with that specific company and that plan. So make note of that. And then prior authorization limits or quantity limits just means that some plans require restrictions where they won't give you a 90-day supply of certain medications automatically. They will limit that to a certain number of prescription or number of medications per month or per period. And then step therapy is another tactic that they use to help the insurance companies save money, which is just really a simple way of saying that they want you to try the lower cost medication first before you move up to a more expensive or a brand name drug, just to help them save money. The other piece of that Medicare prescription plans that you want to understand is exactly how the coverage phases work throughout the year. So this diagram can kind of help illustrate that somewhat. You'll see over on the left here that that's what's called the initial coverage phase. That's where you're paying your premiums for your plan. You have co-pays or deductibles that you have to meet until your total drug cost equals $3,700 for the year. So that's not $3,700 that you pay out of pocket. That's $3,700 that the total cost. So that's what you and the insurance company together have paid for those prescriptions. Once you've reached that $3,700 threshold, then you're in what's called the coverage gap, or the donut hole. Most folks know it as the donut hole. Inside the donut hole, you're going to pay 58% of the cost for generic drugs or 60% of the cost for brand name drugs. So you're going to pay a substantially higher portion of the cost of your medications until your out-of-pocket cost equal $49.50. So that's not the total cost of medications equaling $49.50. That's your out-of-pocket cost for the year equal $49.50. Then you enter what's called the third phase, or the catastrophic coverage phase. And at that point, you would only pay $3.30 for generic, $8.25 for brand, or 5%, whichever's greater there, until the end of the year. So even though you may have great health coverage with original Medicare and your Medicare supplement plan, depending on the medications you take, prescription costs can still be a pretty big chunk of money every year that you have to come out of pocket with. So knowing how this works and knowing how to choose the right plan can really help you save a lot of money in that area. So let's take a look here at exactly what we mean by how do we find one of these plans that's best suited for us. So let's look at that real quick. Alright, so here we are on the Medicare.gov site, and what we're going to go through is exactly how to find and select the right prescription drug plan. So on the main page, you're going to go to Find Health and Drug Plans, green button right there. Then you're going to enter your zip code. In this case, I'm just going to use my zip code here. And we're going to click Find Plans. It'll pop up there. We'll just get rid of that. And then we're going to select that we have Original Medicare. We don't have to worry about any of the other stuff. We can select I don't get any extra help. Unless you do, some folks lower income, you may get extra help that helps cover prescription costs. But for the rest of you, this demonstration is just going to show you how to look at the standard cost under Medicare Part D. Then we can continue to plan results. And then it's going to allow us to select our drug. So this is where Medicare's set of tools here lets us take our medication list or your medication list and apply it against all the drug plans that are out there, so it can find the drug plan that's best suited, that's going to give us the lowest total cost. So make this a little bigger here. So we're going to find medication. I'll just use a popular one here, levothyroxine. That's a very common thyroid medication. We can list our dosage, our frequency, our quantity, frequency. How often do we get it? Do we get it retail or mail order? I'm just going to leave it all as the default here, but you can change that all depending on how you get your medication filled currently, or would prefer to get it filled. Let's put another one in here. We'll say lisinopril. That's a very common blood pressure medicine. Leave that the same. And let's say metformin, for example. That's a common medication for diabetes. Let's say we're going to switch it to the extended release. And same there. So we got our medication list in. This is where it's going to be unique to each of you, depending on what medications you take. If you don't take any, then you can skip this step and just look at the plans that are going to work with the pharmacy that you want to work with, or that have the lowest monthly cost. But if you take prescriptions, go ahead and put those in. You can also save this. It generates an automatic drug list ID and a password date. Save that information, put it in your notes, so that when you come back later or next year even, you can plug that back in and you don't have to start all over with your drug list again. You don't have to enter it every time. You can just use that drug list ID and it'll automatically populate the medications that you entered previously, and you can just update them as you need to. So once we've completed our drug list, we click My Drug List is Complete, and then we can see which pharmacies are in our area. So in this case, I'm going to use Walmart, and let's just say I'll use Kroger as a backup. You can only choose 2 here, but it'll let you pick. You can go further out, distance-wise, if you can't find yours, in that local little 1-mile radius. So then we can continue to plan results. And then we're going to look at Part D prescription drug plans with Original Medicare. These are the standalone drug plans. Continue to plan results. And then so what it's done now is it's looked at the drug list that I've entered and matched it up against the drug plans that are available, and it looks at what the monthly cost is going to be, what the copays are, the deductibles if any of that applies, and gives us a total annual cost based on those medications in that preferred pharmacy. So then we can see here, this one's showing that for those 3 generic medications, the Humana Walmart drug plan's the best fit because it sorts this by lowest remainder of the year retail cost. We can also sort that by lowest remainder of the year mail order cost. But those are the 2 that you'll want to use. And if you're looking at this during open enrollment in the fall, it'll show you what the estimated lowest total year costs are for next year. But since we're in the middle of the year now, it's going to look at the remainder of the year. So in this case, the Humana Walmart plan, it's got an estimated retail cost for the rest of the year, including the monthly premium, of $72. Next best is this WellCare Classic. It's got an estimated retail cost of $105. Then we got Aetna, SilverScript, on and on. So we really don't need to pay attention to any other than really the first one in the list here, because it's going to give us the lowest total cost. If we want to do mail order, then we can sort by mail order. We'll just click sort. It just happens in this case that Humana Walmart plan has the lowest mail order cost as well at $60. So how does it come up with these numbers? If you click into the plan, you'll be able to see the breakdown on exactly where those numbers came from. So we can see this plan's got a $15 per month premium, a $400 per year drug deductible. We can see what the estimated cost would be at Walmart versus Kroger. So this little tool will let you not only compare the plans, but also the pharmacies in your area. So you may be able to shop from one pharmacy to another, and you can play around with that when you go back to the preferred pharmacy and see which pharmacies give you the lowest cost. But in this case, Walmart's going to be the preferred, obviously, because it's the Walmart plan, and then it's got the mail order cost. So we can see the breakdown at Walmart, the breakdown at Kroger, the breakdown at mail order, and we can see even in this case with mail order, they would send a 3-month supply of these medications for $0, so we would just pay the monthly premium, and that's where it comes up with that total estimated cost. If I toggle back here, you can see if we do retail, then it's got the monthly premium plus some copays there, $1 each copay on those medications, and that's where it comes up with that total dollar for the remainder of the year. Again, if you're looking at this during open enrollment, you'll see this all the way from January through December, whether or not you'll hit the donut hole, what your estimated costs are going to be while in the donut hole, so you can break that down on a month-by-month basis, plan ahead, but most importantly, get the drug plan that's going to give you the most coverage for your dollar. And looking at that total dollar figure, really we can ignore the monthly premiums because we know which plan is going to give us the least total out-of-pocket cost. We can see which tier our medications are in. We're going to see the drug list again at the bottom, so you can edit that or change dosages if you need to. So this tool really is what allows you to go in and not get bogged down by all the details and comparing all the plans. Let this do the work for you so that you can save money on your prescriptions and get the plan that's the best fit for you. And it may not be that, a husband and wife, for example, oftentimes they have 2 different plans because their drug lists are different, and we want to make sure that we find the prescription plan that matches up closely. This is something that we do with all of our clients just so that you can better understand how it works, and from there you can either enroll through us in one of these plans. You can just click enroll here and sign up for your own plan. If you want to do it yourself every year, then just make sure you save that drug list ID, and that way you can come back to it and you don't have to start all over. So I hope this video has helped you better understand how Medicare Part D works. Now let's look at when to enroll in the plans. With Medicare Part D, you have an initial enrollment period which starts 3 months before your Part B effective date. And that Part B effective date is usually the beginning of the month in which you turn 65, or if you're waiting to enroll in Medicare Part B because you're still covered with a group plan, then whenever you decide to start Part B coverage in the future. But for most of you, it's going to be the beginning of your 65th birth month. Your Part B effective date, you have that month, and then you have 3 months after that month. So you have actually a total of 7 months to sign up for Medicare Part D. And then each year, as you review your coverage and as your situation may change and your prescriptions may change, then you can make changes during the annual election period, which starts on October 15th of each year and ends on December 7th. And that lets you make a change for the upcoming year. So once your changes are saved and in effect after December 7th, then you're going to be in that drug plan for the coming year. And then every year after that, you just want to make sure to take a look at it. As things change, you may need to change drug plans from year over year if you get new prescriptions or if your drug formulary changes. But you don't want to just ignore that and say, well, my plan works now, I'm not going to change it next year. You want to make sure to take a look at if your plan is changing, what about it is changing, and if that may affect you, because even though your plan works now and you may be happy with it, you could be in for a big surprise come January if, for example, one of your medications gets taken off the drug formulary, or they change pharmacy networks and your pharmacy is no longer a preferred pharmacy and now your copays are all going to go up. So take the time. It only takes a few minutes to plug it in there. Make sure that you're on the right plan for the coming year. And when you're first selecting your plan, again, it's all based on a calendar year. So even if you're turning 65 in November, you're still going to have to shop it again for the coming year. You may have one plan for November and December and then change over to a different plan in January, just depending on what medications you're taking and how that all affects you. Get this far, I really appreciate you taking the time to watch this video. I hope that it brought some value to you and helped you better understand how Medicare prescription drug coverage works, some choices that you're going to have to make and how to make those decisions so that you can save money. If you have any questions, feel free to send me an email or just call us. If you like this video, make sure to like our page on Facebook or subscribe to our channel on YouTube, and stay in touch for Medicare updates as the future holds. Thanks, and talk to you soon.